Why don't we get going, because I know we have a lot to talk about. So I'm going to share my screen quick, just to introduce you, and then we can, I don't know, we can maybe go back to a regular screen. Hello, slideshow. Okay, there we go. Okay, hi everybody. Thank you so much for joining again today and our weekly update. I'm really, so grateful to John Randall for joining us today. I really had a lot of respect for what you do just daily, keeping an agency running outside of this pandemic. But it's totally mind-blowing what you have to do to run just the number and types of services that you offer and the broad population that you serve. It's just incredible. And I also just wanted to mention that I've been really lucky to work with John in advocacy, and more specifically around people with high acuity or complex challenges. And I find him to be just an incredibly effective advocate with DVS leadership and the legislature. So I'm super happy to have you on our team when it comes to advocating for that population in general. So I know you've been in the field for a long time and at Amego for a long time, and I welcome you to give us a little more about your background, but if you want to just jump right into what's going on now, that's great too. And I just wanted to tell people that after you talk today, and we're going to hit on hopefully all of this: day programming, residential, the workforce. I'll stick up for families at home, and we'll hit on a little bit of the budget advocacy update, and as I said earlier, the visitation guidance update that came in yesterday. So that's kind of the goal, and I'm going to hand it right back over to you, John, and thank you again for being here.
No worries. I appreciate being asked to be here. I'll give you in terms of my background, what I do for the orientees that come into Amego during their orientation. Just a quick blurb. I've been in the field. I started working in the field while I was in college, so it's 30 plus years now. And I started working actually for an ARC. So I was out in Hampden County, and worked in individual supports and then in group homework. And I never planned on entering this field, and I kind of fell into it because a professor said, "Are you sure you want to go down the avenue you're thinking of? Maybe try this." And I really did fall in love with it. Then I moved back to the Boston area, worked on an inpatient unit for a few years with young children who had significant behavioral issues. Came back to residential services as a house manager, became a program director, ran a day program here and there, and then went to work for the state for about 6.5 years, running state operated programs in Region 6, and then came back to the private sector as a chief operating officer again for another ARC, and came to Amego in 2008. So I've been at Amego for 12.5 years now. I came in January of 2008. Along the way, I have a master's degree in public administration, a master's degree in education. I'm a board certified and licensed behavior analyst. I've worked with the trade associations for behavior analysis primarily. Currently, I sit on the board. I recently was appointed to the board of the Association of Developmental Disability Providers, and I am on the board for the Council on Autism Service Providers. And I will say that as my career has progressed, I never expected to be a CEO. I kind of fell into it, and I would never come to a job that I didn't love, even during the pandemic. It's been the most challenging time, I think, in all of our careers. And it has been, but it's also been one of the most rewarding times seeing agencies work together, staff work together, although we're not always gonna share information that people wanna hear. The families that we support have been extremely supportive and not always happy with what's happening, but it's been a collaborative effort across the board. but with that, there have been extreme challenges. Maura, I'm just going to talk about kind of how we've approached it.
Absolutely. Thank you so much.
Okay.
I wanted to jump in quick, John, to say in my role, I get a lot of community feedback. And one thing that I hear frequently is that people, how much people appreciate your communication. And that's what you kind of just hit on, that, you know, families hear what's going on. There's weekly and a very, very clear communication. So I think that's been hugely important. So thank you. Sorry to interrupt.
No, not at all. Thank you. Yeah, from the beginning. So we started planning as we started suspecting that there was a pandemic pending, and it was imminent. So in early February, we started having organizational conversations. Toward the end of the month, we started planning for centralized distribution of supplies and food and all that type of stuff. And we had a team that completely reworked what their traditional roles were to be able to support that. On March 12th, we made the decision that we were going to close the day programs the following week, a little bit ahead of when the mandate was coming to close. And I started writing the letter to the family saying we were going to be closing on March 15th. And when I was writing the letter, I remember saying, this is the stupidest thing I've ever done. So we got to close tomorrow. Because as I'm writing it and the rationale for closing, I'm thinking that I should have started writing this a week ago. And so we closed on March 13th. And immediately after closing, we decided we started planning for how to reopen, waited for the guidance from the state, always kind of anticipating what the guidances were going to be, knowing what we had to do to prepare, and trying with a very committed senior team, middle management, and then frontline workforce that's been incredible, trying to stay ahead of what the next step was going to be. And that's been it's been challenging. From the beginning, Maura mentioned communication. In the beginning, probably for the first couple of months, we were doing daily email blasts to all of our stakeholders, and anyone could get on. We didn't care who had access to it. We posted them on our website. A few months into it, we started scaling it back to a few times a week. We had weekly Zoom meetings. They started sometime toward the end of March, and we kept those going until July, and then we went to every other week in July. I think it was either June or July. And so, but during those meetings, we cover the current topics, what's happened that's impacting our services, and what we foresee the next guidance is to be. Maura mentioned the visitation guidance that came out recently for in-home visits. We're going to be looking at that and interpreting as to the best way it fits the people we support. So from the beginning, it's been really kind of analyzing data, and as a behavior analyst, it's on a broader scale, looking at what's trending in Massachusetts, what's trending across the country, and how we have to stay ahead of the curve. One of the most challenging things in the beginning of this was securing the right kind of PPE. And then interpreting what the right stuff was. So we were starting in late February, early March. We had a small supply that we reserved for houses that became directly impacted toward the middle of March. At the end of March, we started having good supply chain contacts, and we started having access to thousands of N95s or KN95s that would be that really are useful in reducing the spread. The population we serve, it's very difficult to serve at social distancing. So when you hear social distancing in homes, whether it's in our children's program or adult programs, or even in our consultative programs where we go into families' homes, the idea of social distancing isn't we can't do it with the people we support. And so we made the decision, as we were able to access the right kind of supplies, that all of our staff would be wearing the N95s or KN95s in the beginning. And then once we realized that the pitch on the KN95 masks was, they're the same thing as the N95s, they're just made in other countries. That's not quite accurate. So we have a nursing team that actually, as we had access to inventory of KN95s, started that would analyze the actual rate of the what N95 and 95 is the magic number. So that means that they block out 95% of the particulates and all of that. But it turns out some KN95s that were coming into the country had a 20% rating, which is worse than surgical masks or even some cloth masks. So we, when we were buying them, we have a standard that we won't go below. I think it's 91 or a 92 on what the standard is, and we make sure that what we purchased meets that or exceeds it. We have some KN95s that are actually rated higher than the N95s. So starting in April, all of our staff all the time who are providing direct services were wearing the higher level masks, and we continue that. We're going to continue that until the end of the pandemic.
Don, can I ask you quick, because I want to talk about budget at some point. How much? I mean, did you get reimbursement for those in the initial stages, or has reimbursement come your way? Where are you guys on that?
We did not get specific reimbursement for the augmented rates that people probably heard about that started in March and continued through the end of June. They didn't. They weren't specific in what they were to cover, although it was clear it wasn't like there was $50,000 for masks or whatever it was going to be. But it was, and I don't have all. I have access to all of our numbers, exactly what we got and what we spent. But we, in addition to protecting the people we support, their families and our staff, we had to augment staff salaries. So we immediately augmented staff salaries for just working their regular schedules. So any staff that worked their regular schedule over the course of a 2-week period would receive an additional stipend based on that. And on top of that, before we got funding from the state for it, we augmented the staff that were working in houses that were directly impacted with a significant hourly increase, and then another additional weekly stipend for being in those houses. Early on, in state-operated programs, and this isn't a state-operated versus private sector thing, state-operated programs were given a $5 an hour differential for just showing up to work. When we got news of that, even with the augmented rates that came in March, April, May, and it was kind of that was disheartening, but the state heard us. So in May and June, they augmented the rates by 25% to kind of give us a little bit closer to break even. Our costs, we figured out what our average daily cash was, let's say in February, and then we compared that to where we were in April. So on a daily basis, we were spending about $15,000 more a day to provide services across 40 adult service group homes with no day program happening anymore, and obviously an increased staffing schedule on first shift with increased rates. So over the course of every month, we were spending close to $600,000 a month more than we had in previous months. Our total spend on PPE to date is about $1 million. So we have, but we have a good supply. So when I say that we're going to, and we've had a good supply since about April, something that a comfortable level. We are in a position now where we have enough masks to keep our staff in them every day through next April. We have, so the $1 million we spent on it, and the prices on masks in the beginning, some places we're asking for $7 a mask, and some places, but we ended up through a lot of work from our board of directors and our other stakeholders, getting access to PPE that was really that was high quality and at lower cost from legitimate suppliers. We were in the supply chain a major medical group, and also we were buying from a medical supply house that we were lucky that we were able to get in with. So in terms of that, so we're never going to make this money back. There's no way that you can, but as we got deeper into it and as we continue through it, it is clear to us that using the N95s and the KN95s that are high quality prevent the spread. We had cases back in June where one staff would come in with a positive. We'd have every individual in the house tested, every staff person in the house tested, and no one would have tested positive other than the one staff person who had come back with a positive. All along, our staff our families made huge sacrifices by not seeing their loved ones for months, and it was we really worked. We had several families who took their loved ones home in the beginning, and we said we don't know when they can come back. We started working in May to start bringing people who were struggling in the family home to come back. We offered families the opportunity to come back with some the screening questions that you would expect, and with some isolation protocols for the first 2 weeks when people came back into the residences. Our staff, and then in June we started with more robust family visits, and I think we might have gotten slapped a little bit on that one because we might have started visiting a couple of weeks ahead of the state saying okay, but we got through that okay. But we had really tight guidelines in place in terms of what the visits would look like, and it was important for the people that we support, a lot of them, to start seeing their families again. Our staff in some of our homes moved into the homes for months at a time. So in early April, late March, we had some staff that didn't go home until mid-May, or even in home till June. So staff literally locked down in the house with the people that they were supporting. So the sacrifices our staff made have been absolutely incredible. We had staff make pacts with each other that they wouldn't work in other places, that they would that their mission was to keep the people that they support safe. So they really have been, I think, in society in general, they're forgotten. You don't think of people, staff are working in a group home. People see people working in grocery stores, Targets, Walmarts, they're all being called heroes, and the work is admirable, and they have kept society moving. But our staff, without a lot of praise or understanding of what they're doing, are providing critical services at high risk to themselves. So they've been incredible during this. We, as an agency, and we were pushed on this a little bit from the beginning from some of our families. We didn't, and agencies collaborated. So some of us had one approach, others had another. We never mandated our staff to get tested until the state mandate came out. I will tell you, when someone was symptomatic in a house, all of our staff got tested anyway. We provided mobile testing. The mobile test units went out. All the staff that worked in the houses got tested without the mandate that you have to go get tested. So we were very successful in supporting our staff through that. But it clearly, the risk of spread was coming from staff. The staff would go home. They'd have to go shopping. Many of them who didn't lock down were coming in, were coming to work, and we didn't know. I would say early on that the first cases we had came from one of our clinical staff who would visit multiple sites, and this was before any mention of the lockdown. So in early March, let's say this clinician had to go into 4 or 5 houses, became symptomatic, got tested, and then Pandora's gate it opened the box. It was in those houses that she went to, we ended up with positive cases in all of them. So it was clear to us that we needed to keep these as locked down as we possibly could. but when you look at the numbers, testing is really important. It gives you a good snapshot of where you are in that moment. Now with surveillance testing coming up in the next couple of weeks, we're really going to have a good understanding on a bi-weekly basis, pretty much, of where we stand. During baseline testing that was mandated in August to be completed by the end of this month, we got it done by September 11th. We had 0 cases of COVID in a workforce of over 600 during baseline testing. Subsequent to baseline testing, we did have one staff, a teacher actually in our school program, come back positive, but there was no spread as a result. After the lockdown, after the isolation period, we haven't had any further spread. But
can I just jump in there around the testing? Because one thing we actually have on our advocacy platform now is making sure, kind of like we did with PPE and hazard pay, equitable pay for workforce, right in the beginning, that providers are getting reimbursed adequately for all this testing, that the testing can be as fast as possible so people aren't in lockdown or being sent home or staff isn't unable to work. Are you finding the support there for that kind of robust testing that we all feel like will alleviate huge fears in us?
Simply yes. Yeah, you know what? The state has been a very good partner in this. There are some, there's obviously some variance in what we get reimbursed versus what we have to pay for testing. But we'll advocate for it, and they'll listen, and we'll land in a good place. I'm not. One thing that we have not gotten at Amego, and I know most of our counterparts haven't gotten stuck on a few dollars here and there. We have to do what we have to do at this point. The test reimbursement rate during baseline, I think it was $150 per test, and I don't know how there is a reduction in that during surveillance testing, but we have a team of people securing the path to surveillance testing that will put us on track for what the rates are going to be reimbursed at. There's no administrative fee for doing it or anything like that. So we're on track for good surveillance testing, and the rates are reasonable.
How's the turnaround on the test?
It's been a day. It's been great.
Oh, that's great.
Yeah, we've heard the anecdotal stories of like 3 weeks or it's taken a week here and there.
Yeah.
I don't think any of our staff have waited more than a couple of days since the. Hold on 1 second.
Yeah, that's great news.
Hold on, I'm going to mute for 1 second.
Yeah. I know people have been really concerned about the testing, so I just wanted to bring it up. But I mean, it sounds like Amego is really on top of all of this. So thanks, John.
This is a funny story. So the fire department, no, the fire department is at our office now, because last week we realized we might have too much hand sanitizer, so we asked for them to come and tell us how we're supposed to store it, because we did we came across a regulation that you're not supposed to have more than a certain amount on site at a time, and we've exceeded that, so we called them to come to how to put it in place.
That's a great story. It's good to have more. Just don't blow up.
Yeah, exactly.
Okay, so keep going, John. Then we'll wrap up and take questions too at some point. But keep going.
Yeah, there's a question that I saw come in. So we have opened our day programs on a very limited basis, and we're probably at 35% capacity right now. We have not furloughed any staff. Some staff left at the beginning of the pandemic out of what could be construed as reasonable anxiety about coming to work. But for our agency, we have most of the people that come to our day programs, maybe 10 or 15%, 10 or 15% probably live with other providers or in the family home. But most of the people that come to our day programs are are living in our facilities anyway. So day program staff that may be subject to a furlough or a layoff have been reassigned to residential programs. So we haven't had to furlough or lay anybody off during this. We had we did in the beginning when we restructured the management structure to put more administrative support in the program divisions. We did have some administrative turnover, but that was it. As an agency, I would say that the biggest challenge for us has been letting our staff know how we appreciate them, and it has been and work and obviously even though the communication might look good, sometimes I feel like if we're a couple days behind on something, we have to get caught up really quickly, and it has caused for kind of an anxious executive team on occasion, but we've come together and done an okay job of staying ahead of the curve on most of this. But it has been again, the most challenging time in my career, but also a very rewarding time seeing the interagency collaboration, the state private sector working together, working through some significant issues, but getting to a good resolution.
Wow. I mean, so just to clarify, those that are in the residential services, they're getting their services in residential from some of the day program staff currently.
And we did reopen our day program back. I don't have the exact date. It was either late July, early August. We reopened our adults day programs, and so we do have people coming in on a hybrid model. And obviously, the cost of we couldn't come to capacity based on the spacing requirements and the reduced capacity in rooms. We've strategized that when our homes are coming back into day programs, the homes stay together now. That hasn't always been the case. So while you can imagine that the individuals we support have had to be very flexible during this, and they have been. We've been very lucky that we haven't seen especially for the populations we serve, a huge uptick in clinical acuity or any major behavioral concerns during this very difficult time.
That's really incredible. So it's so interesting to hear from your perspective, sort of the timeline of everything that happened, because we've been meeting here every week. And we actually had Joanne Simons from the Northeast Arc on, but I think we had her on prior to day programs even closing, so right in the beginning. But we've been following all these issues and trying to advocate alongside the providers, but it's just fantastic to hear it from your perspective and to give us that insight. I want to open it up for people to ask you questions. I also just want you to give us your thoughts on sort of the future of some of our services in terms of congregate settings, and what Amego is thinking in terms of financial stability of these programs, and in terms of what really is safest and best for our folks going forward, if you guys have been thinking through any of that.
I know that not everyone agrees that the congregate care model is ideal, and there's been pushes for alternative service models over the last several years. For the population we support, I think that the model itself is strong. What worries me right now is that with the question that came in about going back and forth between day programs and what capacity is a rework of the system to allow for like a 24/7 model for more people to be supported out of their homes. This year, the budget is, there really isn't a budget, but it's predicated on a 1/12 allocation from the prior year until things get worked through. That is going to be a challenge for us as we are staffing our residential programs 24/7. Our costs have increased dramatically. That that 1/12 budget from a prior year has got to get augmented so that we can cover the first shifts. And in some, we have one home that supports 3 young men who have some challenges, and there are 5 staff on at all times. So 5 days a week, there are 5 staff that we're not getting paid for. So if you can think about how that can parlay into something really bad, that's going to get challenging.
Absolutely. Thank you for mentioning that. We do have some legislative staff on today, and so I wanted them to hear sort of that perspective on it and how challenging it is with the budget right now. And we do have a slide to talk a little bit more about the budget and each kind of DDS line item. But I want to make sure people get a chance to ask you questions. If anybody just wants to unmute or chat in their question for John, we still have a couple of minutes. We can do that. Mike Maloney also asks,
yeah, he's right. Absolutely, Mike. Yeah, I see it. Mike, it's been the decrease in day revenue, not to augment the adult side. I don't know if it's quite 70%, but you're probably right on the money there. Without having that increased kick that we had in April, May, and June, it presents incredible challenges. We're working through it right now. A lot at the beginning, people were hearing there are all these federal programs you can apply to. And one of them was the payroll protection plan. We were, as an agency, Amego wasn't eligible because we have too many employees. The cutoff was 500. And also when you cut up the industry, there was no way we could get at that. So that would have been a huge relief to us at that time. Then CARES Act kicked in for Medicaid relief, and depending on how financial reports are filed, there were some variances in what agencies were able to capture. We did get some money from that, and if there is another round, we should be able to get a little bit more. But I think what we got initially was $280,000, and on a $50 million budget, that was not that wasn't close to what we could have used. While there has been relief here and there in the state, especially Massachusetts did a really nice job in the beginning augmenting the res rates. And then they also kicked in for the children's res rates in July. The uptick in revenue doesn't come close to covering the costs.
Wow. Incredible. All right, I think that unless somebody wants to just jump in and ask, go ahead and do so. But I think I'll go back to sharing our slides, and feel free to stay on, John and Betsy. I'm
going to step off for a minute just to check on the fire department. I'll be right back.
Oh yes, please do. And thank you so much for giving us that. I'm going to just jump right back to my slides quickly. Where are they? Okay. Oh, from current slide. There we go. There we go. Okay, so as John mentioned, we are still on that 1/12 budget, but looking forward to seeing what budget comes out at the end of this month. We're hoping to see a maintenance in our budget line items, but as John said, maintenance is probably not going to cover our needs. We're also looking at a few other priorities. So additional assistance for individuals and families who are at home. And flexibility in the delivery and reimbursement of day and employment supports at DDS and at Mass Health. So given the way that services are being delivered, hybrid models, even in-home services, we need those agencies to really be flexible and think about the short-term and long-term sustainability of these provider services. Same thing with flexibility in residential and shared living. AFC has had very little attention and funding directed toward them. And again, making sure that we are addressing the need for and also for any kind of additional cost for testing and keeping individuals safe. We really want to see those testing regimens on par with other frontline services. In the beginning of the pandemic, we really weren't considered frontline healthcare workers, and having to fight for that hazard pay and equitable pay. We don't want to have to go through that again around when vaccines come or when testing is available. We want to be right at the front of the line for those things. So again, if you, when I send out these slides to everybody, I'll send our updated budget ask, which includes some of those things I just talked about. And we obviously can use everyone's advocacy around this. We're going to come back to that slide. I just wanted to say, if you have a story to share with your legislator, please do so. Now's the time. Now's a really great time. If you want to share it directly with me, you can email it to me and I'll get it to your legislators and use it for the ARC as well. This story was, I thought, particularly moving, and Carrie Mahoney was able to get this so we could share it. But Emily and Rich are in their late 70s, providing 24/7 care for their son Alex. And although the day programs are reopening, the risk of the virus and him bringing it home at their age was too much. They're trying to engage him in remote. It's difficult. He doesn't attend. He's bored and restless. The parents very tired and depressed and don't know how much longer they can do this, but have no other choice. So super powerful for advocacy, to tell your story. And I think some of us are at that point where we've kind of accepted this huge challenge, but telling your story is important. Others, we all need to hear it. And we need to be able to move on some of these priorities for families as well as providers. So, and just, I only had a chance to look at the indoor visitation guidance, and I don't know if John can comment a little bit on this as well. I did see that families will be able to come into the homes as long as there has not been any suspected COVID in the past 14 days. It looks like a lot of the guidance is similar in terms of PPE and staying physically distant. But I don't know, John, do you have any comments on the new indoor?
Yeah, it's basically I took a quick look at it last night when it came out. Haven't had a chance to really dig into it yet. Good news is the fire department was very cool. We have to put a pod outside and get our PPE into a pod. But
really?
Yeah. But that was good. But the on the visitation guidance, we're going to many of our families are taking their kids home on for day visits on weekends. Our staff are transporting them. We've supported visits from the beginning. We have a handful of families that have not been able to that can't take their kids home for clinical reasons. And so they've only been able to be supported with the outdoor visits. We are going to support visits for them either at remote locations, meaning our day programs, or on 3-season porches or that type of thing, so that we have we have some garages that we've finished to support visits. But the indoor visits are set. The guidance is pretty. It allows for some interpretation. We're still keep our houses on as locked down as possible, but obviously, especially as the cold weather approaches, for the families who simply have no other options, we're going to figure out how to support indoor visits in a way that keeps everybody safe.
That's great. I'm hearing a lot from families who are at the point where they feel like they need to get into the house. They need to see their son or daughter's face and make sure it's clean, and make sure, families who've been really, really patient are starting to feel like, how are we going to go into, another winter season without getting in there? But I totally understand the need to keep lockdown and keep, really, really careful. So I like the idea of these sort of outside.
Yeah, families do want to see the kids' bedrooms, and we get that. And I'd be lying if I didn't say that we've had some exceptions to families getting, especially for people who might have had either a COVID illness or to bring materials in. And there's going to be some procedural drift, we'll call it, when you have house managers basically who are really tight with these families, with the people, with the families and with the individuals, not making a judgment call that might not be perfect, but we've done our best to kind of set up the guidelines for people to follow. We early on, our staff did incredibly well using technology, FaceTime, walking them through their kids' rooms so that they were able to see that the rooms were clean, that they were wearing the clothes that the families preferred, and that type of thing. So it's not the same as being in the physical space, but we've supported people getting access to it and dropping off the supplies or the personal items that help them connect to their kids.
Fantastic. Thank you, John. The only other thing I was going to mention is just an update on our police training amendment. We're still, at this point, waiting for conference committee. I don't know if, John, you guys know, but our police training and autism bill was filed as an amendment and accepted, and it's now part of the police reform legislation. And I was hearing last week that it was still pretty solid, but we really need that bill to move out of conference committee and over to the governor. So again, if anyone wants to do some further advocacy on that, be in touch, and I can walk you through where we're at and what needs to happen. And I just really want to thank you so much, John, for being here today, and really appreciate all that you've shared. And maybe you can come back and tell us how things are going in like January or February, and hopefully it'll be even better picture then.
Anytime. Thank you for having me.
Right. Thank you. All right, everybody, please have a safe week, and hopefully we'll see you again next week. Okay. Bye, everybody.